Now we go to the 5 transporting points, the Shu points, energetic actions, part 2. Spring points. At this point, the Qi of the channel is very powerful and full of potential energy, ready to manifest like the swirling movement of water in a mountain spring. Hence, the spiritual axis says that at this point of the Qi slips or glides like it is swift. Because of this nature, the spring points are also very dynamic and powerful points which can quickly change situation. They all have a particularly strong action and are generally used to eliminate pathogenic factors, whether interior or exterior, and in particular to clear heat. Because of their dynamism, these points are to be used sparingly. The spring points of the feet are more powerful than those of the hands, and if there is a choice, those of the hands are to be chosen first. For example, in deciding on a distal point to affect the temples in migraine headaches due to rising of liver yang, one might have a choice between using the gallbladder or triple burner channel spring point, GB43 or TB2 respectively. The triple burner spring point is slightly less powerful and dynamic than that of the gallbladder channel, and therefore it might be preferred, especially in cases of first treatment. Of course, this does not mean that the spring point of a hand channel is always to be preferred to that of a foot channel, as in many cases, one does not have a choice, or one might deliberately want to have a particularly strong effect. The spring jing points summary, we have, it is the second point from the fingers or toes. It is dynamic, like the swirling movement of a mountain spring at its source. It clears heat, fire point in yin channel, and water point in yang channels. Stream point at this point of the Qi of the channel pours through, it swells and flow starts to be bigger and slightly deeper within the channel. At this point, the flow of Qi is rapid and large enough to carry other things with it. Hence, it is named transporting. At these points, exterior pathogenic factors can be transported into the interior and penetrate deeper in the channels. On the other hand, at these points, defensive Qi gathers. Stream points, it is the third point along the channel except GB41. Qi pours, flows become bigger and deeper. The pathogenic factors enter through this point. Defensive Qi concentrates at this point. River point, at this point, the Qi of the channel is much bigger, wider, and also deeper. The Qi flows like a large current, and after coming a long distance from this source. At this point, the exterior pathogenic factors are deviated towards joints, bones, and sinews. This is probably why the points are called jing, which is in this case means pass through. The river jing points, it is the Qi of the channel which much bigger and deeper. Qi flows like a current. The pathogenic factors are deviated towards joints and sinews at these points. Next, the C point. At this point, the Qi of the channel is vast and deep. It collects, comes together, and joins the general circulation of the body, like a large river flowing into the sea. According to the chapter 65 of the Classic of Difficulties, at this point, the Qi has an inward centripetal movement as opposed to the outward centrifugal movement of the well point. Compared to and contrasted with the well points, the C points are much less dynamic and their effect is less quickly and dramatic. This is due to the fact that the C points, Qi flows much slower and it flows inward and deeper so that it is not unstable and can be quickly and easily affected. The C, he points, summary, Qi of the channel is vast and deep. Qi of the channel goes deep in the body and joins general Qi circulation. Centripetal movement, less dynamic than other transporting points. Now we go to here another table, names and function of the 5 transporting points. Sa pinyin, we have the jing, the literal meaning is well, and the terminology is well. Next is the pinyin is jing, and the literal meaning is spring or pool, and terminology is the spring. Next is shu, the literal meaning is to transport, and the terminology is stream. Next is jing, literal meaning is to pass through, which is the river. And next is the he, to unite or to join, which is the sea. Thank you for your attention.
Let's discuss the source points or yuan points according to the Classic of Difficulties, chapter 66. This chapter of the Classic of Difficulties lists the 12 source points as we know them. That is, one for each of the 6 yin and 6 yang organs. The only difference with the source points, as normally known nowadays, is that it lists both pericardium 7 and heart 7 as source points for the heart. This is due again to the fact that in those times, the heart and pericardium were considered as one organ, and the pericardium could not therefore have a source point. The rest of this short chapter clarifies the relation between original Qi, triple burner, and source points. It says, the original Qi is the motive force, or Tong Qi. Situated between the 2 kidneys, it is life-giving and is the root of the 12 channels. The triple burner causes the original Qi to differentiate for its different uses around the body. The original Qi passes through the 3 burners and then spreads to the 5 yin and 6 yang organs and their channels. The places where the original Qi stays are the source or yuan points. This chapter therefore confirms that the source points are in relationship with the original Qi. In contrast to chapter 1 of the spiritual axis, the Classic of Difficulties says that the source points can be used to tonify both yin and yang organs. In particular, the role of the triple burner as the ambassador or avenue through which the original Qi arises from in between the 2 kidneys and differentiates into various forms to spread to the 5 yin and 6 yang organs explains a particular use of the source point of the triple burner channel, triple burner 4. This point can be used to tonify original Qi directly and activate its circulation in the channels. Combined with the source point of the stomach, stomach 42, triple burner 4 tonifies Qi and the original Qi. So here you could see the relation of the original Qi or Yuan Qi and the triple burner. As you can see, the Yuan Qi is actually situated between the left and right kidneys, and it is able, it is conveyed by the triple burner to reach the 5 zang and 6 fu organs to on its way to the 12 channels. So to summarize, the description of the source points by the Classic of Difficulties, the source points are in a relationship with the original Qi. Original Qi reaches the internal organs, 12 channels, and finally, the 12 source points through the intermediary of the tripal burner. The source points tonify both yin and yang organs. Thank you for your attention.
Let's continue our discussion on the connecting or the Lu points. And for today, specifically, we discuss about the connecting channels. The connecting channels are more superficial than the main channels, and they run in all directions horizontally rather than vertically like a net. In particular, they fill the space between the skin and muscles, that is the Li space. The 12 main channels are situated between the yang and yin connecting channels. It is through the yin and yang connecting channels that nutritive and defensive qi and blood of the main channels spread in all directions, permeate, and irrigate the internal organs. It is also through the connecting channels that the essence of the internal organs is transported to the main channels and through them to the whole body. The connecting channels cannot penetrate the big joints of the body as the main channels do, and they are therefore restricted to the spaces in between the deep pathway of the main channels and the surface of the body. For this reason, they are very prone to stagnation of qi and or blood. So to repeat, the connecting channels cannot penetrate the big joints of the body as the main channels do, and they are therefore restricted to the spaces in between the deep pathway of the main channels and the surface of the body. And for this reason, they are very prone to stagnation of qi and or blood. Chapter 10 of the spiritual axis says, the connecting channels cannot course through the large joints. In order to enter and exit, they must move by alternate routes. Then they enter and come together again under the skin, and therefore they can be seen from the outside. To needle the connecting channel, one must needle above the accumulation where blood is concentrated. Even if there is no blood accumulation, one must prick to cause bleeding quickly to drain the pathogenic factors out. If this is not done, the syndrome may develop. Thus, the connecting channels occupy the space between the main channels and the skin. However, within this space, there are also degrees of depth. On the superficial layers just below the skin, there are smaller connecting channels called minute and superficial connecting channels. The main branches of the connecting channels are called B or divergent. This is also the same word as that used for the divergent channels. The minute connecting channels are called Sun, while the superficial ones are called Fu. Chapter 17 of the spiritual axis says, the main channels are in the interior, their branches and horizontal or crosswise forming the connecting channels. Branching out from this are the minute connecting channels. Chapter 10 of the spiritual axis says, the more superficial branches of the channels which can be seen are the connecting channels. However, the connecting channels also have a deep layer beyond the main channels. This can be called the deep connecting channels, and they are connected to the blood vessels and blood in general. One can distinguish three layers in channel network related to Wei, Qi, and blood. So in summary, number one, on outside, this is the superficial connecting channel or the defensive Qi or Wei level. At the center, the connecting channels is of the Qi and nutritive Qi or the Yin level. On the inside, the deep blood connecting channels or the blood level. These three levels could be related to the four levels of defensive Qi, the Qi level, the nutritive Qi, and blood. Thank you for your attention.
Okay, we continue with the back transporting points, the shoe points, the diagnostic uses. The back transporting points can also be used for the diagnostic purposes as they become tender on pressure or even spontaneously tender when the corresponding organ is diseased. The spiritual axis discusses this and other aspects of the back transporting points in chapter 51. The back transporting points for the center of the thorax is below the tip of the big vertebra. The Du14, that is for the lungs, is below that is for the heart below the fifth vertebra. That for the diaphragm below the seventh vertebra, and that for the liver below the ninth vertebra. That for the spleen below the 11th vertebra, that for the kidneys below the 14th vertebra. All of them are situated 1.5 June from the spine. Soreness is relieved on pressing on these points. Moxa is applied on these points, never needling. In order to tonify them, one lets the moxa cones burn out on the skin slowly in order to sedate them. One blows on the moxa cones and then puts them out quickly. This passage establishes the use of the back transporting points in diagnosis when they become tender on pressure. The last statement could seem surprising as it forbids the needling of these points, which are needled so frequently in practice. The prevalent view is that prohibiting the needling of these points was an overcautious attitude so that they would not be needled too deeply. In fact, these points, and especially those on the upper part, should not be needled deeply. Because of the possible injury to the lungs, they should be needled quite superficially, but not just under the skin and obliquely towards the midline. Another point of interest in this passage is the mention of a method of moxibustion for drainage, contrary to the prevalent idea that moxibustion is generally used for tonification only. In addition to the above line of back transporting points along the bladder channel, there are also six other points on the outer line of the bladder channel on the back which are particularly important. So we have the bladder 42, door of the corporeal soul, level with bladder 13, which is the lungs. Bladder 43, the transporting points, level with bladder 14. Next is the bladder 44, hall of the mind, level with bladder 15, the heart. Bladder 47, door of the ethereal soul, level with bladder 18, the liver. Bladder 49, house of the mind, level with bladder 20, the spleen. Bladder 52, room of willpower, level with bladder 23, the kidneys. With the exception of bladder 43, the other 5 points exert a special effect on the corresponding mental aspect of each of the 5 yin organs. That is the corporeal soul, the pu of the lungs, mind, shen, of the heart, ethereal soul, Hun of the liver, intellect, the Yi of the spleen, and willpower, Shi of the kidneys. The explanation of the acupuncture points says that these points are like a window, door, or gate. It says that the 5 yin organs are stored or hidden, but this can be seen from the outside at these points. These points can therefore be used in emotional and psychological problems of the relevant yin organs. It is strange that in spite of their names linking these points to spiritual aspect of the 5 yin organs, the old texts do not report many mental, emotional indication of these points. However, in my experience, these points do have a profound mental, emotional effect as indicated below. Bladder 42 can be used for deep emotional problems related to sadness or grief affecting the lungs. Bladder 44 can be used for emotional problems related to the heart causing anxiety and insomnia, in particular if due to heart fire or heart empty heat. Bladder 47 can be used to help a person find a sense of direction in life. It is very useful in certain cases of depression when the person feels confused and unable to plan his or her life. This is also effective to treat other emotional problems related to the liver, manifesting with mood swings, a feeling of frustrations, resentment, and anger. This point can both stimulate when the person is depressed or restrain when the person is manic, the movement of the ethereal soul. Bladder 49 can be used in patients who exceed in mental work or who are prone to pensiveness. Bladder 52 can be used for kidney deficiency manifesting with greater exhaustion, depression, lack of willpower, and feeling of powerlessness and hopelessness. Thank you for your attention.
Let's now go to front collecting points, or the Mu points, or the alarm points. Today we will talk about Ren17, chest center, Danzhong. Ren17 is located on the anterior midline, on the level of the 4th intercostal space. How to find Ren17? So using the quick method, especially in men, we locate Ren17 on the sternum between the 2 nipples. For a more detailed orientation on the intercostal region, first we have to locate the manubriosternal synchondrosis, which can be felt on the sternum as a well-defined horizontal bone structure on the level of the costal cartilage of the 2nd rib. The 2nd intercostal space is below it. From there, count in an inferior direction to the 4th intercostal space. Locate Ren17 on this level, on the midline of the sternum. Located on the same level in the 4th ICS are kidney 23, stomach 17, pericardium 1, spleen 18, gallbladder 22, and gallbladder 23. Tutsun lateral to the midline on the nipple, 1 tsun lateral to the nipple, or 6 tsun lateral to the midline on the axillary line, 1 tsun anterior to the gallbladder 22. Needling, depending on indication, 0.5 to 1 tsun transversely or subcutaneously in a superior or inferior direction or towards the nipples for mammillary disorders. Caution, intracardiac needling, pneumothorax. The sternum can be very thin in this area owing to embryonic ossification disorders. Moxibustion is recommended to tonify the Qi, but used with caution on asthmatic patients. Actions or indications: Ren17 regulates and benefits the Qi, unbinds the chest, descends counterflow, lung, and stomach Qi, benefits the breasts. Special features: Ren17 is the front midpoint of the pericardium, meeting point with the spleen, kidney, small intestine, and triple burner channels. This is also the Hui meeting point of the Qi, C of Qi, and an important point for respiratory disorders. Ren17 is a very important point to tonify the Qi. It is both the gathering point for the Qi and the point of the C of Qi. Ren17 tonifies Qi of the chest and the gathering Qi or Zong Qi, which is related to heart and lungs. Thus, this point is used to tonify Qi, but only in relation to lung Qi, not so much the spleen or kidney Qi. If the Qi deficiency is due to weakness of the stomach or spleen, this point alone would not be enough to tonify Qi, but we have to use other points like stomach 36, Ren12, and Ren6. Besides tonifying Qi, Ren17 also moves the Qi and eliminates Qi stagnation in the chest. It is therefore used in any condition of Qi stagnation in the chest with symptoms like feeling of constriction, tightness, oppression, or pain in the chest. Ren17 dispels fullness from the chest, promotes descending of lung Qi, and helps breathing. It is therefore used for breathlessness from any origin, whether it is from lung Qi or heart Qi deficiency, or from obstruction of the chest by phlegm. Ren17 benefits the breasts and can be used to treat insufficient lactation, both from deficiency of Qi and blood and from Qi stagnation. When used for the breasts, Ren17 is inserted towards the affected breast. When used for Qi, it is inserted horizontally downwards. Summary of functions. Ren17 tonifies the Qi, strengthens the gathering Qi, which is manifested as weak voice, tiredness, propensity to catching colds, spontaneous sweating. Ren17 opens the chest, regulates Qi, and promotes descending of Qi, manifested as chest pain, wheezing, breathlessness, cough, fullness, and oppression of the chest. Ren17 benefits the breasts and promotes lactation. So insufficient lactation, breast abscess, breast distension. According to the spiritual pivot, Ren17 is the C of Qi, linking with Du14, Du15, and stomach 9. This passage states, when the C of Qi is in excess, there is fullness in the chest, urgent breathing, and a red complexion. When the C of Qi is deficient, there is scanty energy, insufficient for speech. These indications reflect the ability of Ren17 to regulate Qi in the chest, as well as to treat breathlessness with inability to speak. The spiritual pivot says that the gathering Qi accumulates in the upper Qi, with its lower pathway flowing down to stomach 30 and its upper pathway entering the respiratory passages. Located in the center of the chest, Ren17 has a strong effect on the gathering Qi, which in turn oversees both the lung functions of dominating Qi and controlling respiration and speech, and the heart function of governing blood and blood vessels. According to the illustrated supplement to the Classic of Categories, Ren17 can treat all types of uprising Qi and dyspnea. When the lung fails to descend Qi and control respiration, whether due to attack by exterior pathogens or to interior disharmony, there will be various manifestations of accumulation or rebellion of Qi, like cough, dyspnea, wheezing, asthma, and fullness and oppression of the chest. Ren17 is an important local point to relieve such accumulation of Qi in the chest and to descend rebellion of lung Qi. When gathering Qi is deficient, then both lung and heart Qi will be deficient. In the lung, there will be shortness of breath, whilst if the heart Qi fails to move the blood and the blood vessels in the chest, there will be chest painful obstruction and pain of the heart and chest with fullness and oppression. Ren17 is one of the primary points to regulate the gathering Qi. The action of Ren17 on descending rebellion of Qi extends to the middle jaw, and it restores harmony to the stomach in difficult ingestion, acid regurgitation, esophageal constriction, and vomiting. Located midway between the breasts, Ren17 is a principal point in the treatment of insufficient lactation. According to observations of women by Zhang Qingyue, Qi and blood in the conception and penetrating vessels in women transforms into menstrual blood when it descends and into milk when it ascends. Delayed or insufficient production of milk after delivery is due to Qi and blood deficiency. Whilst the book Literatis Care of Parents states, sobbing, crying, grief, anger, or depression lead to obstruction of the milk passage. These two quotations illustrate the two main patterns underlying insufficient lactation, namely deficiency of Qi and blood and Qi stagnation. In either case, Ren17 may be used in combination with other suitable points and is frequently found in combination with SI1 in classical combinations. Similarly, Ren17 is often used clinically in the treatment of distension and pain of the breast and breast abscess. When any of these breast disorders is unilateral, the needle at Ren17 may be directed towards the affected side to induce Qi sensation into the breast, whilst if the disorder is bilateral, the needle may be directed first to one side and then to the other. Thank you for your attention.
Okay. Let's continue our discussion on the accumulation points or the Xi points. For today, let's discuss LI7, or what it is also called warm flow, or the Wenliu. LI7 is located 5 tune proximal to the anatomical snuffbox in the direction of the lateral end of the elbow crease, or 1 tune distal to the midpoint of the line connecting LI5 and LI11. So how do we find LI7? First, we have to note that with the hand supinated, the line connecting LI5 and LI11 runs alongside the radial margin of the forearm. However, with the arm pronated, it transverses the forearm. So LI7 lies on the dorsolateral aspect of the radius and is best located with the forearm in mid position and the elbow flexed. Using the spreading hands technique, we place the little fingers on LI5 to LI9 and span the hands evenly so that the thumb joins at the midpoint of the line. From there, measure 1 tune distally to the triple warmer 8 is located 4 tune proximal to the wrists, crease, between the radius and the ulna in the center of the dorsal forearm, or 1 tune distal to LI7. Okay. So with LI7, needling is done vertically at 0.5 to 1 tune depth. For its indications, it is used to treat acute disorders, to clear heat and toxic heat, and to regulate the stomach and large intestine. As its special feature, it is the Xi-cleft point. LI7, like most accumulation points, stops pain and removes obstruction from the channel and is particularly useful in acute situations. It is widely used in painful obstruction syndrome of the channel and also heat conditions of the mouth and face. LI7 opens the mind's orifices and mental, emotional conditions occurring against a background of heat and the bright young. As mentioned before, whenever ancient books mention seeing ghosts or talking to ghosts, it usually means that the point is indicated in serious mental conditions such as psychosis. So, in summary, LI7 is, as an accumulation point, it is used for painful and acute conditions of the channel. It clears heat in the face, like swollen tonsils, facial furuncles, and others. It also opens the mind's orifices. LI7 is the Xi-cleft point of the large intestine channel. The Xi-cleft points are where the qi and blood, which flow relatively superficially along the channels from the jingle points, gather and plunge more deeply. The Xi-cleft points in general are indicated in the treatment of acute conditions and pain, and this is reflected in the ability of lung or LI7 to clear heat and detoxify poisons in cases of clove sores, carbuncles, and furuncles, throat painful obstruction in heat and swelling of the face. Clove sores are small, hard, deep-rooted, clove-shaped, purulent lesions. They are primarily due to unregulated diet or external wind and fire poison, which invade the superficial portion of the body. The condition tends to develop very rapidly with severe localized pain, redness, and swelling, which is often accompanied by fever. One notable feature of the Han-Yang channels, which includes the large intestine, the Danzhong, and the small intestines, is that relatively few of their points treat disorders of their corresponding fu. As far as the large intestine channel is concerned, large intestine 7 and its following points, LI8 and LI9, however, are indicated for disorders of the intestines and stomach. In the case of LI7 for berberigmus, accompanied by abdominal pain, abdominal distension, and vomiting of foam or watery saliva. This follows the general principle of all yang channels, most clearly seen on the leg yang, that as the points approach the elbow or knee, they begin to have a greater action on the corresponding fu. It should be noted, however, that in clinical practice, points of the large intestine channels are rarely used for disorders of the intestines. And this is born out of the absence of LI7 in combination for this purpose in any of the major classics. The action of LI7 on clearing Yangming fire and calming the spirit, and thus treating frequent laughter, raving, and seeing ghosts is similar to that of LI5. Thank you for listening.
Now we go to the gathering, the or meeting points. Ren12, the middle cavity, song 1. Ren12 is located on the anterior midline, fortune superior to the umbilicus or fortune inferior to the sternal costal angle. To locate the distance between the sternocostal angle, 3.5, and the center of the umbilicus can be divided into 8 tune, which can vary considerably from the patient's finger tune. Therefore, only proportional tune measurements should be applied here. Helpful device, elastic tape to point 3.1 from the center of the umbilicus, measure either 4 tune in a superior direction or from the sternocostal angle, 4 tune in an inferior direction. There, locate the Ren12 on the anterior midline, or spreading hands technique. Place the little fingers on the sternocostal angle and the center of the umbilicus respectively, and determine the midline. So that is the Ren12. Of this distance by joining the fingers. Locate on the same level are the kidney 19, 0.5 tune lateral to the midline. Stomach 21, 2 tune lateral to the midline. The needling 0.8 to 1.5 tune vertically or obliquely towards surrounding points. Stomach 21, Ren10, Ren15. So we have the to be cautious about the peritoneum sa pregnant. If indicated, moxa is recommended. Actions and indication: harmonizes and tonifies the needle burner, descends, counterflow Qi, regulates the Qi flow, alleviates pain, transforms dampness. Special features: the front midpoint of the stomach, meeting point of the small intestine, triple burner and stomach channels, meeting point of the food organs, major point for functional stomach disorder. Ren12 is a major point for many stomach problems, although its indication clearly shows that it can be used to harmonize the stomach and promote the descending stomach Qi in full conditions. I personally used it primarily to tonify stomach and spleen Qi in deficiency patterns, as opposed to Ren11 and Ren13, which are better for excess patterns. Firstly, it tonifies the stomach and the spleen Qi, especially if combined with stomach 36. It has a gentle action and is not a strong tonifying point. It can be used in any deficiency pattern of stomach and spleen with such symptoms and signs as lack of appetite, tiredness, and dull epigastric pain relieved by eating. It is the best point to use, particularly with moxa, for empty cold patterns of the stomach and spleen. This could be used directly on the point with moxa cones. Or the point can be heated with a moxa stick, or a moxa box can be applied on the area around the point. The moxa box is a wooden box without bottom, with a metal girdle about a third of the way down from the upper edge. Loose moxa is placed on the metal girdle and loose lid is placed over the box. This method of moxibustion is excellent for empty cold conditions of the stomach and spleen. So we have here a moxa box, the illustration. Okay. The Ren12 can also nourish stomach and spleen yin, and I use this point whenever the tongue lacks a coating, which indicates a deficiency of stomach yin, or when the tongue has a stomach crack, even in the absence of any digestive symptoms. When this is used to nourish stomach yin, this is combined with Ren12 and stomach 36 and spleen 6. Ren12 has a general tonifying effect also because it is the gathering point of all the young organs. Another important use of Ren12 is to resolve dampness and phlegm It does so by tonifying the spleen's function of transportation and transformation of fluids. It is very widely used in any pattern involving dampness or phlegm in any part of the body. It is interesting that the traditional indication for this point includes worry, anxiety, and pensiveness. The Ren12 is very effective in calming the mind in patients who suffer from digestive problems caused by emotional strain. For this action, combined with Ren12, with Ren15, and DO24. Finally, Ren12 also subdues rebellious stomach chi, that is the stomach chi ascending instead of descending, but the use of Ren13 for this function. So we have the summary of functions. Ren12 tonifies stomach and spleen for tiredness, loose stools, poor appetite, weak limbs, desired to lie down. It also resolves dampness and phlegm, abdominal fullness, a sticky taste, a feeling of heaviness, nausea. It also regulates stomach chi, all diseases of the stomach and spleen, epigastric pain, poor digestion, easily full, nausea, sour regurgitation, nausea, vomiting, epigastric distension. It also calms the mind, those who worry with anxiety and pensiveness. Thank you for your attention.
Let's talk about chronic fatigue syndrome, specifically the pattern dampness in the muscles. This is a full pattern. Clinical manifestations: pronounced ache in the muscles, feeling of heaviness of the limbs, muscle fatigue on slight exertion, tiredness and sleepiness, feeling of heaviness of the body or head, no appetite, feeling of fullness of the chest or epigastrium, a sticky taste, poor memory, lack of concentration, a muzzy or fuzzy feeling of the brain, and a dull headache. Tongue, sticky tongue coating, slippery pulse. In case of damp heat, there will be feeling of heat, thirst, but without desire to drink, bitter taste, slightly dark urine, yellow vaginal discharge, loose stools with offensive odor, and yellow tongue coating. If damp heat affects the gallbladder and liver, there will be bitter taste, hypochondrial pain and distension, and possibly jaundice. A sticky yellow tongue coating will be concentrated on the sides. If damp heat affects the bladder, there will be urinary difficulty, turbid urine, and burning on urination. The tongue will have a sticky yellow coating on the root with red spots. Dampness can overflow into the space between the skin and muscles and cause the typical muscle ache experienced in chronic fatigue syndrome. It also causes the feeling of heaviness of the muscles, especially in the limbs. Dampness can also cloud the brain, hence the poor memory and concentration and general muzzy feeling. The other manifestations are mostly due to dampness obstructing the stomach and spleen. Treatment principle for dampness in the muscles: resolve the dampness, if necessary, clear heat. Points: spleen 9, spleen 6, bladder 22, Ren12, Ren9, LI11, spleen 3, stomach 8, triple burner 7, DO14, all with reducing or even method. Spleen 9, spleen 6, and bladder 22 are used to resolve dampness. Ren12 and Ren9 to regulate the transformation of fluids, therefore help to resolve dampness. LI11 to clear damp heat. Spleen 3 to resolve dampness, especially from the brain. Stomach 8 is an important local point to resolve dampness from the head. TB7 relieves pain in the muscles. especially that occurring against a background of heat. Du-14 clears the heat. This is an important point to use as it is particularly effective in clearing chronic, hidden, and lingering heat, such as that which occurs in chronic fatigue syndrome. Now, let's have some case history. A 27-year-old woman contracted viral meningitis 1 year before she came for treatment. At the time of contracting the infection, she had high temperature, severe headache, vomiting, photophobia, neck pain, and rigidity. Before this occurred, she had had vesicles on her feet. These were itchy and filled with fluid, and after some weeks, they turned into pustules. After the meningitis, she felt extremely tired and experienced a feeling of heaviness and ache of the limbs. She also felt hot and thirsty. On interrogation, she said she experienced a sticky taste in her mouth and had an excessive vaginal discharge. She also had some abdominal pain and her stools were always loose. Her memory and concentration were poor and she sweated at night sometimes. She was quite overweight. Skin was greasy, spoke very slowly. Pulse was slippery, tongue body color normal, while there was a very sticky yellow coating all over. Tongue body was swollen. She had been treated with acupuncture by another practitioner. Whilst some of the symptoms got better, they both felt that she had not made sufficient improvement. Diagnosis: most of her problems are due to the remaining damp heat after the febrile disease from the meningitis. The manifestations of damp heat are tiredness, heaviness, and the ache of the muscles, being overweight, greasy skin. Greasy skin is very indicative of dampness in the muscles. Poor memory and concentration, sticky taste with dampness in the head, excessive vaginal discharge, pustules on the feet, which indicates dampness in the lower burner, night sweating, slippery pulse, and sticky tongue coating. Thirst, feeling of heat, and the yellow color of the coating indicate heat. In this case, dampness was predominant in relation to heat. The main reason she had not improved much was that she had been treated by tonification only. In fact, various signs showed that her body condition was not that deficient. A normal tongue body color without cracks, and a slippery pulse that was not weak. Since the condition was predominantly still an excess one, characterized by damp heat, the treatment should have been aimed at expelling dampness first. Treatment principle: treatment was aimed at expelling damp heat first with herbs only. Thank you very much for your attention.